Welcome to Kanerika's podcast, The Digital Shift. Today we're taking a deep dive into a sector that's, well, it's really ripe for revolutionary change. Healthcare. And think about this number. Healthcare organizations are grappling with an astounding $150 billion in annual losses.
That's huge.
It's huge, right?
Yeah.
And mostly down to administrative inefficiencies. It's a massive drain. But here's where it gets really interesting. Some places, like Atlanticare, they're not just stopping the losses, they're actually reducing it.
Okay.
Their providers, they're saving a remarkable 66 minutes. Every single day.
Wow.
That's over 5 hours a week back from paperwork, back to patient care. And it's all thanks to AI agents. So yeah, we're talking about AI agents in healthcare today, but let's be really clear here. These aren't your typical chatbots we see everywhere.
No, not at all.
We're exploring these autonomous software systems. They're analyzing massive amounts of medical data, making informed decisions, executing complex workflows, pretty much independently.
Yes.
This isn't just about, small improvements. It's about fundamentally modernizing, streamlining, and really elevating the entire healthcare system. Our mission today, we want to unpack the incredible, tangible impact these AI agents are having. We'll pinpoint the key areas where they're making a real difference and give you a clear framework for understanding their value. And we'll try to do it without getting bogged down in too much technical jargon. So what does this all mean for you, for the future of healthcare? Let's unpack this.
It really is a transformative moment. When we talk about AI agents, we mean these sophisticated software systems. They're designed to operate autonomously. They can perform both clinical and administrative tasks. They're built to observe, process information, make decisions within certain parameters, of course, and then act. They take initiative.
That initiative part, that's a crucial distinction, isn't it? What really sets them apart from, say, a simple chatbot that just answers questions?
Well, the key difference is that autonomy and complexity you mentioned. A basic chatbot needs constant human input, or it just follows these rigid scripts. An AI agent, though, it analyzes huge data sets, identifies patterns, makes informed decisions based on that analysis, and then it executes complex multi-step workflows, all on its own.
Right.
So they can, for example, automate the whole patient intake process, actively support diagnostic decisions by cross-referencing information, and significantly improve hospital operations because they act, they don't just react.
That proactive capability, yeah, that's what makes them so compelling. Okay, this sets the stage perfectly. Let's jump into the 7 key ways these AI agents are genuinely elevating healthcare operations right now. First up, automated clinical documentation.
Absolutely. This is a big one.
Right.
Imagine an AI agent acting like a virtual medical scribe, only much more advanced.
Yeah.
It listens to patient-provider conversations in real time, captures the nuances, and then automatically creates structured clinical notes.
Yeah.
These systems understand complex medical terms, context. They can even tell the difference between clinical details and just casual chat.
And the practical impact of that. I mean, what does that look like on the ground?
Oh, it's profound. Providers consistently report saving up to 2 hours daily on charting tasks.
2 hours. Wow.
Yeah. These agents transcribe the encounters. They automatically generate SOAP notes, subjective objective assessment plan, the standard format.
Right.
And they update the electronic health records, the EHRs, directly. And what's more, they reduce documentation errors by something like 40%.
40%.
Which isn't just about cleaner records. It means fewer malpractice risks, smoother billing, and crucially, safer patient care because the information is accurate.
2 hours a day for a clinician. That's a total game changer. That's time back for actually talking to patients.
Yeah.
Okay, let's move to number 2, intelligent patient scheduling and flow management.
Right. This is an area where, traditional admin work has always created bottlenecks. AI agents completely rethink scheduling. They optimize the daily schedules by analyzing tons of data points, appointment history, specific needs for procedures, even real-time resource availability.
So they're not just looking for an empty slot on a calendar, they're looking at the whole operational puzzle.
Exactly. These systems can predict no-shows with 85% accuracy.
85%, that's impressive.
It is. And they can automatically fill canceled slots. That means better capacity use, much shorter patient wait times. They manage complex scheduling across different departments, send out personalized automated reminders, handle rescheduling requests through natural language. All of this boosts appointment adherence by around 30%. The real insight, AI turns a static schedule into this dynamic, responsive system.
That sounds like a dream for any busy clinic manager. Okay, number 3, diagnostic support, and clinical decision-making.
Yeah, this is where AI gets really powerful with complex medical data. AI assistants analyze patient data, lab results, imaging studies, and they provide evidence-based diagnostic suggestions. But what's fascinating is they don't replace the physician's judgment. They offer additional insights, maybe deeper ones, that might get missed in just the sheer volume of information.
Can you give us an example?
Yeah.
Something concrete.
Sure. Think about IBM Watson's AI agent. It showed 99% accuracy in identifying rare leukemia cases, matching expert human conclusions even when the initial diagnosis was missed.
99%.
Yeah. These agents compare symptoms against huge medical databases. They can flag potential drug interactions before a prescription is even filled and provide real-time clinical guidelines right there during the consultation. It's a powerful partnership, augmenting human expertise, not replacing it.
A powerful partnership indeed, enhancing what doctors can do. All right, next up, number 4, revenue cycle and claims management. This sounds like an area where automation could have massive financial implications.
It absolutely does. Administrative AI agents are now handling things like prior authorizations, verifying insurance eligibility, processing claim submissions autonomously. This dramatically cuts down claim denials because they catch errors before the claim even goes out. That's a huge pain point for providers.
And the bottom line impact, financially.
Healthcare organizations are recovering millions, literally millions in previously lost revenue, just through AI improving coding accuracy. These agents use natural language processing, NLP, to read clinical notes and automatically code procedures. They can appeal denied claims, pulling the needed documents instantly. They even track reimbursement patterns to spot underpayments. So the insight here isn't just efficiency, it's reclaiming revenue that was just slipping away before.
Huge savings, massive reduction in admin headaches. Okay, number 5, 2,147 patient engagement and support.
Right, so think virtual health assistants. They're providing round-the-clock patient support, answering common medical questions, triaging symptoms, all without needing a human right then and there, which, of course, frees up human staff for the more complex critical cases.
How do patients feel about interacting with AI for health concerns? Is there pushback?
Actually, studies show patients often prefer the immediate AI response for non-urgent things, rather than waiting for a callback. Yeah, these agents do initial symptom assessments, recommend the right level of care, manage medication reminders, track adherence through little conversational check-ins. Some can even provide mental health support between therapy sessions using evidence-based techniques. It really improves accessibility.
Incredible accessibility, especially, like you said, in underserved areas. Okay, coming in at number 6, predictive analytics for preventative care.
This is where we really shift from being reactive to proactive health management. AI agents are continuously monitoring patient data, looking for those early warning signs of deterioration or disease progression. These predictive systems analyze patterns across thousands of variables, data points a human just couldn't process manually, or certainly not in real time.
And the results, I imagine they speak for themselves.
They absolutely do. Hospitals using AI for patient monitoring, they report about a 20% reduction in readmission rates.
20% reduction, wow.
And get this, these agents can predict sepsis onset up to 6 hours earlier than traditional methods.
6 hours, that's life-saving potential right there.
Definitely. And they identify high-risk patients for targeted interventions before complications even start. The real insight is how AI shifts healthcare away from crisis management towards proactive, preventative wellness managed at scale.
Prevention is always better than cure, as they say. Okay, finally, number 7, workflow optimization and resource allocation.
So AI agents are analyzing huge amounts of operational data, looking for bottlenecks, suggesting process improvements across the entire facility. These intelligent systems coordinate between departments, they manage bed assignments efficiently, optimize staff schedules, allocate equipment where it's most needed.
Leading to what kind of overall impact on the hospital?
Well, the result is significantly smoother operations, much better resource utilization. They can predict ER volumes and adjust staffing recommendations. They manage surgical suite turnover by coordinating cleaning and setup. They even optimize supply chains by predicting usage and preventing stockouts. The insight: AI creates this synchronized, efficient healthcare ecosystem. Less waste, better throughput.
These applications, they really demonstrate the immense potential here. And, we at Kanerika are right at the forefront of designing these purpose-built AI agents. We work to tackle specialized business challenges, making decision-making faster, more accurate across lots of industries, including healthcare.
Yeah, our approach really focuses on secure, purpose-built intelligence, something that adapts across industries and just simplifies work. We look for specific pain points and transform them into streamlined processes. It's all about practical, measurable outcomes. So, for example, in specialized information retrieval, we've developed DocGPT. It lets you use natural language queries on documents to get insights faster.
Okay.
Or for smart data analysis, there's Carl. It generates visual trends from structured data just using natural language commands. These are just a couple of examples of how we build solutions tailored to very specific needs.
With so many solutions popping up, a critical question for you, our listener, has to be, how do you choose the right AI agent
How?
for your needs? What are the key things to look for when evaluating them?
That's a really important question, yeah, because the market is expanding so rapidly.
Yeah.
We've identified 7 sort of crucial criteria. First, and maybe most importantly, clinical accuracy and validation.
Right.
Any AI tool helping with diagnosis or clinical tasks must be reliable, period. That means it needs validation against real-world data, support from peer-reviewed studies. You need transparent metrics like sensitivity, specificity.
So absolutely proven effective and trustworthy. What's next?
Second, EHR integration and workflow fit. An AI agent is only really valuable if it fits seamlessly into the existing systems, like Epic or Cerner. It needs to support standards like HL7 and FHIR. Those are basically the universal languages healthcare systems use to talk to each other, sync data in real time, and fit into the daily routine without adding extra clicks or hassle.
And given how sensitive patient data is, data privacy and security must be top of mind.
Absolutely non-negotiable. Compliance with HIPAA here in the US or GDPR in Europe is critical. The agent has to show robust data protection from start to finish, strong encryption, strict access controls, regular security audits. It's all about building and maintaining that trust.
What about regulatory status and oversight? Do these agents need some kind of official stamp of approval?
Yes, depending on what they do. Not all AI agents are technically medical devices, but if they make clinical suggestions, if they impact patient care directly, they might need FDA clearance or similar approvals. They get classified as software as a medical device, or SAMD.
SAMD, okay.
Yeah, that status is vital. It shows the vendor met rigorous safety and quality standards.
And for just practical day-to-day use, usability and adoption seem key, right? Will people actually use it?
They really are. I mean, even the most advanced AI will fail if it just makes workflows more complicated. Ease of use, minimal training needed, working well on both mobile and desktop. That's all critical for adoption in busy clinics. You have to see how quickly staff can actually learn it and get comfortable.
Then, of course, the money, pricing, and total cost of ownership.
Right. You have to look beyond just the subscription fee. Factor in integration costs, IT support, ongoing maintenance. Pricing models vary per user, per encounter, enterprise licenses. It's vital to compare them and ask for a real-world ROI benchmarks from similar clients. See what others are actually saving.
Good point. And finally, vendor reliability and support, choosing the right partner.
Exactly. Hospitals need partners who'll deliver consistent updates, maintain compliance over time, and offer prompt, reliable support when things go wrong. You should definitely look at case studies, ask for client references, check out the vendor's long-term stability, their funding, their service level agreements. It's a long-term relationship you're choosing.
So many angles to consider. It really paints a full picture of the complexity, but also the opportunities. Let's briefly spotlight some specific agent categories and examples that are making a difference right now.
Sure. In clinical documentation and virtual scribes, you've got solutions like Innovaxer Provider Copilot. They're already serving over 96,000 providers across major U.S. health systems, automating notes, integrating with EHRs. Another one, AWS Health Scribe, offers this flexible pay-as-you-go model for transcription with IPA compliance baked in.
Okay. And for patient engagement and support.
Well, there's Hippocratic AI. They're specifically tackling staffing shortages with autonomous agents, helping patients with admin, and even some clinical support tasks. And Ada Health provides those personalized symptom assessments we talked about, helping patients figure out what to do next.
For clinical decision support, IBM Watson Health keeps coming up.
Indeed. It reaffirms its capability with that, really impressive 99% accuracy in matching expert conclusions for complex cases, like rare diseases, by analyzing just vast amounts of medical literature and patient data.
And we also see these specialized healthcare agents filling really specific niches.
That's right. Mental health AI agents, for instance, they're offering 24/7 availability, particularly in underserved areas, providing continuous support between therapy sessions. And diagnostic AI agents are achieving things like 94% accuracy in detecting lung nodules from scans, significantly better than traditional reviews alone. These specialized tools really highlight the power of focused AI.
These insights truly show the breadth and depth of AI's potential here. And again, we at Kanerika, we specialize in this agentic AI, AAML. We help organizations across all sorts of industries, healthcare, finance, manufacturing, retail, you name it, helps them reimagine how they work.
Yeah, our promise is really focused on practical, measurable outcomes. We design solutions that bring real efficiency gains, sharper insights, and importantly, lower costs. We build purpose-built AI, generative AI models that address very specific business needs, removing bottlenecks, streamlining operations. We're really all about building AI systems that work in the real world, driving agility, improving productivity, and getting businesses ready for the future, whatever sector they're in.
So we've explored how AI agents aren't just some tech novelty. They are a fundamental force that's reshaping healthcare. From automating documentation, improving diagnostics, optimizing workflows, enhancing patient engagement, these intelligent systems are making healthcare more efficient, more accurate, and much more accessible. Hopefully, you now have a good framework to understand their impact and evaluate their potential for yourself.
And as we think about these profound shifts AI agents are bringing, just imagine a future where pretty much every administrative task in healthcare is handled autonomously. Think about freeing up every single clinician to focus solely on patient care. How does that fundamental shift redefine the human element in medicine? What new opportunities for connection, for compassion, for truly personalized care might emerge when that huge burden of paperwork is finally lifted?
A truly provocative thought to leave you with. Thank you so much for joining us on the Digital Shift. We hope this deep dive into AI agents in healthcare has given you some valuable insights. We'll be back soon with more explorations into how digital innovation is transforming our world.